Hey everybody, it's Ann Beebe. Today is Monday, February 25th, 2019. I'm Barb Hammer. I am looking out on the coast mountains of British Columbia. I'm in Vancouver, British Columbia, Canada. I'm on the rooftop patio of the downtown hostel where I'm staying. The French is toit terrasse for rooftop patio. Je suis sur le toit terrasse, or as I like to say sometimes, the twat terrace. This is the twat terrace. Little joke there. Anyway, so you can just barely see the mountains there through the buildings, the skyline here of Vancouver. So I'm the hostel where I'm staying. It's in two buildings, and this is like a 4-story building. And this is, I think, this building is where the private rooms for the hostel are located. So the private rooms consist of, you just have a simple small room with a double bed and a sink, and then there's a shared bathroom. There's a men's and women's, and then just a single private bathroom with a sink and a toilet and a bathtub and shower. And that's the arrangement. And it's a pretty good deal because Vancouver is extremely expensive. So this is the most affordable accommodation you're going to be able to find, really. So I'm in the building. I'm on the rooftop where the private rooms are located, and some other, there's like a games room with a pool table and a library and a TV room. And so over here, this building on the other side, that's where the dorm rooms for the hostel are located. So I'm just gonna look around here a little bit. Yeah, okay. And I'm trying to get away. I don't want to point this where the sunlight is. So this is what the terrace looks like here. So that's where the elevator is. And then there's some potted shrubs, and there's a greenhouse here. There's an emergency exit here too. And so you can get a bit of a view, but the buildings block a lot. And there's an alleyway down there and side street. And this is located. This hostel is in downtown Vancouver, in the very trendy, posh West End. So this is where people, if they live in Vancouver, they want to live in the West End of downtown Vancouver. And so it's pretty decent accommodations, pretty affordable, considering this is in the West End of Vancouver, which is an extremely expensive city, and the homeless rates are skyrocketing. There's a bridge, I don't know if you can make out, there's a bridge over there. And so I was here on Saturday for the Hands Off Venezuela protest, and it was really rainy, cold, damp, dark day. I wish the weather had been like today. They would have had a much better turnout, but it was okay. And then I'm staying for a few more days. Let's see, tomorrow I have an appointment to see an eye specialist because I have retinal problems. I get a lot of tears. Anyway, I wanted to tell you about people get a little curious about what the health insurance or health coverage, public health coverage here is. So it's decent. You get pretty decent coverage. It's not perfect. A big problem is, the perfect example is the eye appointment that I'm going to. So I'm seeing a specialist. He's the best in the whole province of British Columbia. And I actually became acquainted with him when I lived up north in northwest British Columbia. And so my husband had a detached retina, and what happens when you live in a remote area, which most of British Columbia is remote, so the populated area is just around Vancouver, really, and the lower mainland. And so you're going to get the best health care if you live in Vancouver and the immediate surroundings. Otherwise, you're kind of screwed. It's kind of dodgy. If you have enough money, you can get access to better care, but the government doesn't pay for the transportation or anything. So when I used to live in northwest British Columbia, my husband had a detached retina, so it was an emergency. So we had to fly down the very same day to Vancouver at our expense. I had to accompany him. He had to have someone with him. Very expensive. And that's what happens. There's no one to treat a detached retina if you live in a more remote area. Basically, if you don't live in Vancouver, you're kind of screwed. You have to come to Vancouver to get a detached retina treated, or you go blind. And so I'm going to see the same specialist who treated my husband's detached retina, and he's keeping an eye on things. So I have to commute into Vancouver from Abbotsford, where I live, which is a little over an hour's drive, and it's kind of a hassle because the parking situation in Vancouver is terrible. Basically, we just park illegally because we're not in Vancouver very long. We just come in for the appointment. And so my eye appointment, the appointment itself is paid for, but not the transportation or anything, or parking. They don't pay for any of that. And we even have private extended health insurance, and it doesn't cover that either. So for eye exams, regular eye exams in British Columbia are not paid for, or not covered, under the government health insurance. And I don't think the private extended health insurance coverage has gotten terrible. They don't want to cover anything, really. So it's not much help, so they don't pay for anything. So my eye examinations are paid for only because I have a condition, the retinal tears, where they have to monitor the situation. And then my husband, he hasn't had any retinal tears for a while. He used to have that problem. So his eye appointments, he just goes to a regular local ophthalmologist who checks his eyes. And that is covered because he's had that condition of retinal tears. So that's the situation in British Columbia. So coverage, it varies from province to province. It's not a national health coverage that you have in Canada. It's by province, and some people actually, they will move to a different province to get better coverage, really. A lot of things the government doesn't cover, but you do get, basic appointments and basic, if you go to the hospital, if you live in an area where your local hospital can treat you, you're fine, you're covered, you're not going to go bankrupt. I think bankruptcy would be extremely rare here from medical expenses. But there's a lot that they're not covering, and the eye examinations they used to cover. I remember when I came to BC, to Canada, in the 1990s, they did cover them. So they're chipping away at the coverage, and that's the neoliberalism of the public health service here, public medical coverage, health coverage. They're chipping away at it, so it's still good. I don't have to worry about basic things like appointments, doctor's appointments or whatever. And it can be a challenge finding a doctor, a good doctor. And I don't know, it's not perfect, but basic coverage we have. But they are chipping away at it bit by bit. So anyway, I guess that's the situation. Nice sunny day in Vancouver. So I will talk to you again soon. Bye.